Hey there, Sam Ogdock here, Senior Solution Engineer for Torrent Consulting's Healthcare and Life Sciences team. I'm going to spend the next few minutes walking you through our Addiction Treatment Center, or ATC Accelerator, for the behavioral health space. COVID-19 has drastically increased the need for addiction treatment services. As a result, healthcare providers are recognizing the direct correlation between mental illness and substance abuse. Behavioral health and addiction treatment centers have been feeling increased burdens across their businesses, from the inability to capture and follow up with client leads, to inefficiencies in their intake processes, and a lack of interoperability with their EHRs. To address these challenges, we developed our Addiction Treatment Center Accelerator, which comes equipped with a bi-directional integration connecting Salesforce's Health Cloud to their EHR. Our accelerator streamlines internal operations, builds a scalable foundation on Health Cloud, and can be stood up and operational in just 12 weeks, compared to over 20 weeks for similar implementations. I'll be walking you through a demo of key features of this accelerator from the perspective of an end user. As a call center team member or marketer, I start my day from the lead list view, where I can view a list of potential clients. Let's open up one of these prospective clients now and take a closer look. As we look at this prospective client, I can see key information about them that was captured either through a web form, previous call, or EHR integration. At the top of the record, we can see the highlights panel that surfaces key information, as well as the overall stage that the prospective client is in. Scrolling down the page, we also capture demographic, communication, and address information, as well as service, insurance, and lead source information. Based on qualification criteria defined by the business, are we able to provide the requested services? Do they have the appropriate insurance? And are they in our operating geography? We can choose to convert this lead to capture additional information. Through the EHR integration with Redox, when a lead is converted, the client data is passed through and created within the EHR. We can see the EHR generated medical record number populated here on the client record. We can also see that through the lead conversion process, all of the information captured at the lead stage has carried over to the client record. I want to draw your attention to the tab in the center titled PHQ-9. Within the behavioral health space, there are a number of common assessments that must be conducted to determine medical necessity. By leveraging Salesforce's discovery framework and Omni Studio, we are able to create both standard and custom assessments directly within Health Cloud. In this demo, we've built out the PHQ-9 assessment and are able to capture unique patient responses, including dynamic scoring based on the populated responses. Completed assessments with response history can be found on the Related tab. Also within this tab, you'll find repositories for member plans, which capture client insurance history, as well as referral history. I'll use a more built-out client record to demo the referrals. Here we see Cami Wordsley, a past client that has been referred to us multiple times. Let's open up one of her referral records and take a deeper look. Here we'll see some high-level information about a particular referral instance for Cami. We can see the stage of the referral, the date it was received, as well as key client demographic information. We can also track more detailed information about the referral. Who referred this client, and how did they hear about our services? If we're unable to provide them services, where did we end up referring them to? Referrals capture key information that allow addiction treatment centers to easily report on key metrics, such as top referring providers, referral trends, and client conversions. With all of this information captured in one system, we're able to generate robust reports and dashboards, providing the business with rich information to drive strategic, data-driven decisions. Our Addiction Treatment Center dashboard informs organizations on their prospective leads, referrals, and assessments, including client lead by source, client lead by insurance, client leads by type of service requested, and the client lead pipeline, which shows where all client leads are in the intake process. In the event that client leads are disqualified for service, we also track the breakdown of the reasons for disqualification. From a referral standpoint, we track very similar metrics, including client referrals by status, client referrals by payer, client referrals by referring organization and referring individual, as well as client referrals by referred to organization and referred to individual. Additionally, we have a dashboard component that tracks the number of assessments that have been completed. Our ATC Accelerator comes equipped with a near real-time bi-directional integration with over 85 EHR systems. This addresses the common problem in the behavioral health space where EHRs operate as independent systems, burdening providers and limiting care coordination. Using Redox's framework to provide standardized messaging, we're able to build configurable mappings using clicks, not code, to store inbound EHR data within Health Cloud, as well as send outbound data from Health Cloud to the EHR. The ATC Accelerator also comes equipped with a detailed logging component that tracks all inbound and outbound messages between Health Cloud and the EHR. This allows organizations to diagnose and troubleshoot any integration issues that may arise. Our Addiction Treatment Center Accelerator streamlines internal operations while building the foundation to scale on Health Cloud. We have worked with several addiction treatment centers and behavioral health organizations that desired additional functionality, the likes of which that we've listed here. In general, most of these add-ons require an additional 1 or 2 weeks based on complexity and requirements. Assessments can be highly customized to the organization. Other than the discovery framework, tools like Flow or Catalyst can be used based on complexity of requirements. Computer telephony integration selection is typically custom based on the customer's current phone system and requirements. With benefits verification, not all organizations will perform VOB within Salesforce, making tool selection custom to their needs. Experience Cloud is used to manage client or alumni communications, as well as provide support resources. Lastly, Marketing Cloud is commonly used for alumni messaging and referral marketing. Torrent's Addiction Treatment Center Accelerator provides an out-of-the-box solution for client access, network engagement, and clinical workflow support for addiction treatment centers.